Coronavirus update. Australian cases rise above 30 as expert warns more are inevitable. Travel advisory to Italy issued. Australia has confirmed more cases of coronavirus, including the first in Tasmania, which, like other recent cases, is a person who travelled through Iran. Experts have warned that new cases here are likely inevitable. The federal government's travel advisory to Italy has been increased, and the chief medical officer has defended quarantine measures taken around the Diamond Princess cruise ship in the wake of the first COVID-19 death in Australia. This article is no longer being updated. For the latest coronavirus news and updates, follow this story. Advisor to Iran's supreme leader dies. Iranian state radio says a member of a council that advises Supreme Leader Ayatollah Ali Khamenei has died after falling ill from a new coronavirus. The report on Monday said Expediency Council member Mohammad Mohammadi had died. He was 71. The council advises Ayatollah Khamenei, as well as settles disputes between the supreme leader and parliament. His death comes as other top officials have contracted the virus in Iran, which has the highest death toll in the world after China, the epicenter of the outbreak. Those sick include Vice President Mahsa Amini, better known as Sister Mary, the English-speaking spokeswoman for the students who seized the U.S. Embassy in Tehran in 1979 and sparked the 444-day hostage crisis, state media reported. Also sick is Iraj Haruki, the head of an Iranian government task force on the coronavirus who tried to downplay the virus before falling ill. South Korean cases rise again, second U.S. death, Delhi reports cases. South Korea reported 123 new coronavirus cases, taking the country's total infections to 4,335, the Yonhap news agency said, citing health authorities. The updated numbers added to the 476 recorded earlier by the Korea Centers for Disease Control and Prevention. Ministry of Health. 2,338 people are talking about this. That news comes as Czech Prime Minister Andrej Babiš announced no flights from South Korea or northern Italy would be allowed to land in the country. In the United States, a second death has been recorded, and like the first, it came in Washington state. In India, cases of coronavirus have been reported in the capital of Delhi. Who says cost will be hundreds of millions. The World Health Organization (WHO) has released $15 million, $23 million to help fund global efforts to contain COVID-19, but says the full cost of the cause will be in the hundreds of millions. The announcement came as the WHO upgraded the global risk of the coronavirus outbreak to very high, its top level of risk assessment. The WHO has said there is still a chance of containing the virus if its chain of transmission is broken. The UN funding has been released to the WHO and the United Nations Children's Fund (UNICEF). It will fund essential activities including monitoring the spread of the virus, investigating cases, and the operation of national laboratories. The WHO has called for $675 million to fund the fight against coronavirus. There is a window of opportunity to contain the spread of the virus if countries take robust measures to detect cases early, isolate and care for patients, and trace contacts. Emergency Relief Coordinator and Under-Secretary General for Humanitarian Affairs Mark Lowcock said, "We do not yet see evidence that the virus is spreading freely. As long as that's the case, we still have a chance of containing it." More Australian cases inevitable. Peter Calignon, an infectious diseases physician and microbiologist at Canberra Hospital, says more coronavirus cases in Australia are inevitable. Professor Calignon was speaking on ABC News after it was revealed the nation had its first person-to-person transmission of the virus, and said that while the virus is less infectious than he would have thought, there likely will be more cases. If you look at the data coming from China, this is less infectious than I would have expected, Professor Calignon said. It appears that about 2% of people that have had close contact with infected people may acquire the virus.